Ing tutuking programa, mituringan niyang rated PG. Kailangan ing patnube at gabeding pengari para karing kayanakan amanalbe. Kabalen at kakaluguran. Obviously po, magdili-dili na ako na naman ngeni. Ulingin ka na akong kapataday Mama Ray Yumang at inya pong metong emergency meeting po kano. O ini, inabandonanan na ako na naman. Pero sana po abayan niyo ko. Uling para po keng episode ay ni siguraduan ko pong dakal kayo balo. Ing pong pisabyan tamo, metong yang pamasyadong ababalitan medical procedure or metong practice keng pamanulo na dakal pa po yung makibalo. Pero, ngayon ni pong aldongay ni, ibiyemya po kay kayo at panigaralan tayang miyamasamas nung nanoya ba ining ausandang Chiropractic. At nung nanoya po ba, gagawan ing metong Chiropractor. Ayan. Nung kayo po dakal kayo sakit-sakit na katawan, para kay kayo ya po ing episode ay ni. Uling, baloy naman po, miyayaliwa maning lupa, miyayaliwa maning storya, miyayaliwa maning paninap. Pero, metong muing dangalan ing panga Kapampangan. Manibatan mo yun po, keng kayong kayabeng imis Mau Aquino, at ing kayo pong kayantabeng alangeni ay Mama Ray Yumang, keni mo po keng Personalan.
Mau Aquino at Reyuma Personalan.
Kakaluguran. O hindi na po yung amanuan ko kay kayo at dakal kayo abalo, anya tumutok kayo po para karing ating sakit-sakit king katawan ken. Ini pong episode ay ni para kay kayo. Bistaman po at metong yang banyaga ang kakatamong bisita, makasigurado ko pong dakal kayo apulot kaya. Ladies and gentlemen, i-welcome tayo po yung kakatamong bisita ngeni. Metong niya pong ausandang Chiropractor. Nung naniya po ini, pakibalwan tayo po kang Dr. John Keller. Hello, Doctor. Doc John.
Dr. John.
Dr. John. How are you?
I'm fine. How are you doing? Yeah?
I'm good. Thank you very much. Okay. Doctor, I just told our televiewers that they should stay tuned.
Okay.
Because there's going to be a lot that they're going to learn from you.
Oh.
So better not disappointment.
I'll try my best. Yeah?
Okay, Doctor. Dr. John, before we go into what chiropractic is all about, we want to get to know a little about you. Okay? So, obviously, you are a foreigner. You are an American.
Yes.
Okay? And tell us about that.
Well, I grew up in California, and I went to school. My parents still live in Los Angeles, so I did my undergraduate in Los Angeles at USC, which is University of Southern California. At the time, I was actually studying music.
Music?
Yeah.
From music to chiropractic?
Yes, but
At least they rhyme.
well, beyond that, though, see, my major was percussion. So
Wow,
I'm
percussion is
yeah, I'm a drummer.
Drum?
Yeah, yeah.
My
So,
God.
So yeah, I've always been good with my hands, is the idea.
Oh.
And from a very young age, even at 6 years old, I had my first drum set. I played.
Really?
Yeah. I was the drummer in the family. And then when I went to school, I actually studied percussion performance at USC, and that was I graduated in 1992, and I had that degree, and I was actually doing well. I was performing on a regular basis. I had my own band, and I played with local symphonies, doing percussion, timpani.
Okay.
And
so how did you come about getting into chiropractic then?
Well, here's the thing. The reason why I didn't continue to do that for my entire life is I always had back pain.
Oh.
And there's something connected between the two, playing drums, maybe the shoulders and my back. I always had back pain. It actually limited me from really progressing and becoming...
So you would say it's an occupational disorder because of your...
And it is for actually many people, which we might talk about later. Back pain is very common. In fact, 75% of us have chronic back pain. That's 3 out of 4 of us. That's most of us, really.
Really?
Yeah. Well, but the point is, so I was playing and I was enjoying it, and I still do enjoy it. I like to play. It's a lot of fun. But then one day, along the path, and I started to do other things. I got interested in yoga and some martial arts.
And still because you were finding some solution to your back pain? Not really?
Actually, a little bit. And that was part of the reason, too. I was doing yoga because it did give me some relief. I would do yoga and then still play percussion.
Okay.
And then studying Kung Fu, actually, for similar reasons.
Kung Fu is martial arts?
Yeah, actually, yeah.
Okay.
But that's the place where I met somebody, and turned out to be one of my most important mentors in my whole life. His name is Dr. Andy, and he still practices in San Francisco.
He is a chiropractor?
He's a chiropractor.
Oh.
Yeah.
And that opened the avenue for you.
Yeah, well, the reason why is because we were practicing, in one day in the class, and then one day after the class was over, he just pulled out a chair, and he said, okay, anybody want to try this thing that I do? And of course, you're very curious, right? What is this thing? So people all stood in line. They sat in a chair, and he adjusted their neck, which we call
adjusted.
Yeah, which you're holding the neck, and he would move the bones in the neck and made this
cracking sound.
Popping
sound.
And I could see that it was doing something very good for the other people in the class. So of course I had to try. First time, immediately years of pain were gone.
Like a miracle.
Like a miracle.
Wow.
I mean, it did come back a few hours later, and that's when I started my relationship with Dr. Andy.
So you can't get it in one adjustment?
Well, you can get great results in one adjustment.
Okay, you call it adjustment. Para po ka rin talapanalbeta mo. Pag sinabi na pong adjustment, it is actually the spinal manipulation?
Well,
the manipulation of the bones? Is that it?
Well, the adjustment itself is all of the things that might occur in a chiropractic visit. There's particular types of massage. There's some people will test the muscles.
So the procedure.
The procedure itself is called the adjustment.
The adjustment.
And in the beginning part of the adjustment, we do different diagnostic things to tell us what is going on. And later on, in the process of the adjustment, comes the actual thrust itself. It's a quick thrust into the spine or different parts of the body.
You will demonstrate that to us later.
I would be happy to demonstrate.
Not on me, please.
I would love
to. I would like to know. So you were doing good with your career in music as a percussion performer.
Yes.
And
but
but
the back pain was always part of it.
Always part of it.
Yeah.
And then you.
And then when I received this, started getting. It was the first adjustment. Then I went and I visited his clinic. Then I was like, wow, this is great. I learned all the information. I started to get the knowledge. And then I started getting more adjustments. And then big changes started happening to my body.
Did he encourage you to get into chiropractic also? That's why
in time, yes. But in my opinion, it was the changes that I received in my own life that really changed my life and made me see that this is the thing that I want to do. Because of the effect that I had, I realized this is the thing that I would like to do for other people.
Oh, okay. Wasn't it a difficult decision? You studied 4 years for your undergraduate, and then you were doing good with your career. And then wasn't it a difficult decision to say, I have to leave this behind and just follow the path of.
Well, I haven't completely left it behind. I still, when I get a chance, I like to play. But it's more. I have
but
to
not
admit,
for career.
yeah, it's
for
more.
your
It become more of a hobby now because, to me, when doing the adjustment is like playing the human body. Really.
Wow. You still use your hands. You still get to use your hands.
Yes.
Okay. Now, my question is, so you found out you got interested in it, not only for your personal well-being, but
Yeah.
also because you want to help other people.
That's right. Yeah.
How did you make yourself an expert in chiropractic? Did you study? Is there a formal schooling for a
Yes.
chiropractor?
Yes, there is.
Chiropractic? Or is it just something that, you are being trained into for a few months?
Oh no.
How did you get into
it's
did you become a doctor of chiropractic?
Well, first, I had to go back because my undergraduate degree was in music, so I was lacking some science. So I did back to another college for another 2 years,
Wow.
specifically for chemistry, anatomy, physiology, sciences that are applicable later
To the
chiropractic.
human.
Yes, yes. So after receiving, it's about 36, about 40 credits of all these different sciences. After completing that, then I had the prerequisites that allowed me to go to chiropractic school.
Chiropractic school,
Yes.
if you finish chiropractic, is that a degree? No.
Well, well, yes, it is. If you finish the
is.
chiropractic school, you finished all the credits. You've done your internship as well,
Oh.
and you
How
passed.
many years?
And you passed 4 stages of the national board exam. So there's 4 board exams. The 4th one, being a practical, it lasts about 12 hours. You go into different rooms. You have mock patients, and you have to answer.
And how many years did you study?
Oh, about 10 years. That from beginning of my
No,
undergraduate.
I mean, when you graduated, when you became a doctor of chiropractic.
How long have I
long?
spent in college
Yes.
altogether? At least 10 years.
Whoa,
Yeah.
that's more than a medical doctor does.
Yes. And if you'd like to know the true, I can send it to you later. That it's very comparable, actually. So
So why aren't you called a
we're-
medical doctor
No,
then?
because we are doctors of chiropractic. So the degree name is DC.
Yeah.
So a medical doctor is MD.
MD. Yeah, but
So-
we
We are separate. We are separate. There's
okay,
many
what
connections.
can a medical doctor do that a doctor of chiropractic cannot do?
Well, prescribe medicine.
Prescribe medicine. You don't
drugs.
do surgery
We do not do surgery.
because you don't believe in it.
Well, no, we do believe in surgery. In fact, surgery has a proper place and time. So, in general, if there's something that's bothering someone, there's a hierarchy of things that should be done. So, in the beginning, we want to do the least invasive things first.
Of course.
So, chiropractic is very non-invasive. There's no drugs
So it is
involved.
the initial thing that you should do
Yes.
when
If-
you have pains.
Yes. In America, it's well known enough that most people realize if they do have some kind of pain, the first person that would come to mind actually would be a chiropractor. Especially in California, in certain places for sure, the first person they would go is go see the chiropractor because they know there won't be any drugs involved, and there's a good chance that they can have a correction of their problem quickly.
But I'm sorry, but here, particularly in the, well, I don't know about Metro Manila, but here in Pampanga, I can very safely say that very few people
Yes.
know about chiropractic.
It's true.
In fact, the little that they know, before I met you, the little that I know about chiropractic is that it is not comparable to what a medical doctor does, because it is something that you can just anybody can just trained into. But now that I talk to you, it's a 360-degree turn for me. Because now I know that you were trained for 10 years into this practice. And that's why I said you should be a medical doctor. But then again, I have so many more questions, Dr. John. We're just starting with our conversation, and I'm sure dakal po nga makibalo kaya kayo dakal po ing kebalwa na akwayo po Kenny para po karetang dakala masakit keng gulot masakit keng what do you call this keng battle, the neck pains, migraines. Nungi kayo po mag-suffer kayo kay makanyan. Kayo po mamakokan at kayo maglipat channel, huling magbalik ya po ing
Personalan.
Ichiban Asian Mix Buffet and Modern Smokeless Grill. Let's bond at Ichiban. Ichiban Asian Mix Buffet and Modern Smokeless Grill.
Ingka kung pamana, ing dadake kung kabyasnan, kareng balang kainakan.
Ingka kung pamana, ding kana kung obra maestrang mamietula, king matayot kaladwa.
Pamanang pakamalan, pamanang lilingapan, pamanang alangangkan. Santuario de San Fernando Memorial Gardens. Leave a beautiful and lasting legacy.
Santuario de San Fernando, keeping family traditions alive.
Magbalik niya po yung personalan at ini po, continuous pa mo rin po yung kanakong nosebleed, Kenny. Uling yung kakatamo pong bisita. Metong niya pong Amerikanong Chiropractor. Ala pong aliwan nung Dr. John Keller. We're back, Dr. John. Okay, now, I just realized how intensive your training was into chiropractic medicine. Somehow, it removed all my doubts, okay, about what a chiropractor does. Okay, you are not a medical doctor, you are a doctor of chiropractic.
Yes.
Okay, and you deal with pain.
Yes.
Okay.
Yeah.
Like what kind of pain?
Well, any kind of pain, really. So
That involves which?
any part of the body, actually.
Oh.
So you see, we interpret pain as a pain being a signal that the body is saying that something is not right. So instead of what you might get from a medical doctor, which is generally, they'll treat somebody with pain and they usually will give a painkiller.
Yeah, drugs.
Unfortunately, but a lot of times the pain will come back because really the pain is caused by some of these things that we describe in chiropractic called the subluxation.
Subluxation.
Yeah, it's a very fancy word.
Wow.
It gets used a lot. And it's one of the classic words that was used many years ago. Not as much now, but still it really describes a little bit what's going on. So the brain sends the signal to the body from the brain through the spinal cord. And then it travels out through the body, and then it also travels back up and to the brain. So there's a two-way communication between the brain and the body through the spinal cord. Now, it just so happens that because of the nature of the body, you have many bones, the vertebrae. So many different vertebrae, and the space between the vertebrae is where that nerve will come out from the spinal cord into the body, and then also that nerve will come back into the spinal cord to go back to the brain. And it's very common in the body over time, maybe through trauma, maybe through bad posture for a long time, the bones will shift position. And then when they shift position, they will cause a little pressure on that spinal nerve, the nerve.
and then everything goes haywire.
That's right. So you start, you see you have a big stereo, right? And you have a stereo, and you notice that it's a little bit older now, and you notice that sometimes, you turn it on and you get,
Yeah.
right? And then you go in the back
Static.
and you pull one of the wires and you start to shake it, and then it gets clear, right? So that's one way of thinking about it.
That's one myth again that somehow you've broken, because the little that I know about what a chiropractor does is that it involves just the bones.
No, well, okay.
Because of
so
the
we
cracking and
right.
the popping.
So there is the motion, the thrust is given into the bones, but the purpose is to get the bones into the right position so that the nerve has a clear signal.
Okay.
Because if the nerve signals are completely clear, then we say that's the end of all disease. You know why? Because the body heals itself.
So you mean just about any illness
Right.
can be cured?
Well, we're not going to claim that we're going to cure every illness, but we're going to fix the function of the body, so the body's ability, the natural ability.
And then somehow our body will have the chance to heal itself.
Which it does anyway. Anytime that you're healed from anything, it's always your own immune system. You can get a drug, you can get an antibiotic, and it will assist your body's natural healing. But in the end, it will always be your body's natural ability to heal that will really do the job.
Okay. But of course, the procedure, again, correct me if I'm wrong, the procedure involves the cracking of the bones.
Yeah.
Right? Because that's how I would describe a chiropractor before I met you, that a chiropractor cracks the bones.
There are newer schools of chiropractic, and they don't move the bones.
Oh.
But yeah, chiropractic is evolving. So you understand, in America, is the birthplace of it, and there's many. Now there are.
And it's not a new science.
No, it's been around for 140, since the 1870s, actually. Yeah.
Okay.
So,
See, again, that's another myth.
Yeah.
I thought it's a fairly new science.
No,
Okay.
no.
So and it's not even, and it's again another myth. I thought it came from Asia.
Right. So you might think that because you think like a Chinese medicine.
Correct.
But
No,
actually,
it's
no. Chiropractic is an American invention. Yeah.
Okay.
Now it could be that the act of setting bones or moving the body, it's very old. In fact, we believe it could be actually the Egyptians were the first ones to do
Really?
it, because we have some evidence from some of the hieroglyphs demonstrating. Have you noticed the pharaoh goes like this?
Okay.
This is actually one of the moves that we do in chiropractic.
Whoa.
Now this is, a little bit, but we do know that people talk about setting bones and doing this type of thing all over the world. The Torah and the ancient Hebrews, they talked about it as well. Chinese did it 4,000 years ago. So people have been doing similar things. It's the science that we have in chiropractic that makes it chiropractic. So we have,
Okay, Dr. John, some people are hesitant to go to a chiropractor because they feel that there are risks involved. Like for example, I'll give myself as an example. I was diagnosed with spondylosis, okay, cervical spondylosis.
Yeah.
Okay, and I was advised to undergo surgery 2 years ago. But of course, I felt that the pain is not really, naman pumakanta kasakit. The pain is tolerable. So, I didn't follow my doctor's advice. Okay, but I just treated with, I underwent physical therapy.
Oh, okay.
Okay.
So did they give you some exercises?
Yes.
Typically, that's what they will do. Physical therapists, they look and they analyze the situation, maybe ask some questions about what your daily habits.
Yeah.
Then they'll give usually a series of stretches or exercises.
And it treated my back pain.
Okay.
So I felt
good.
that I don't need a surgery because my back pain, well, it comes very seldom now, but unlike before when I really couldn't sleep because of the back pain.
Right.
Okay. Now, my question is, people are so afraid of having their spinal cord, particularly the spinal cord, touched, or if they know that you're going to pop the bones along that line, they're afraid that they'll get paralyzed, because they always say that the spinal cord is very delicate, and just the wrong move might cause you paralysis.
Well, here's the thing. So there are people who had done studies on this, and they were actually thinking the same thing. Because, say for example, you've seen that movie. You've seen the movie, some kind of a kung fu movie, and the good guy is fighting the bad guy. You get to the very last scene, and he pulls the head, right? Oh, that's the end, right?
Right.
So actually, it would be.
Is that true?
No, well, it would be very difficult. You would have to pull very, very hard. I mean, with
Really?
all of your might, really. And the thing about the chiropractic adjustment is that it really requires very little force. And the reason why is because we study very much the spinal, where the bones fit together. So there's a surface. Say this is only a model, but the idea here
This is a vertebra.
Yeah, this would be two vertebrae.
Vertebrae.
Actually, in the lower spine.
Lower
This would be in the lumbar spine.
Lumbar.
But the point is, when we pull the bones apart, there's a shiny surface, a flat surface. It's very very shiny and smooth, where the two bones actually face and touch each other. So we call that the facet. Yeah, and so when we study the spine and all the way up and down the spine, we study the angles where the bones will meet, and they're different in different locations. So when we hold the neck and we put our hand in the right spot, we know exactly which direction to give a force, and therefore it requires very little force.
But how come it pops?
Well, it pops. Yeah. The scientific reason is actually it's nitrogen. So
It's not the bones?
No, it's not the bones.
I thought it's the bones that really crack, no?
No, where the joint meets, there's actually what we call a capsule. So the capsule is around the joint. And inside the capsule, there's a special kind of fluid. It has its own fluid. It's different than blood. It's different than the other fluids in the body. And when you move, when you put the thrust in there, the size of that capsule changes just a little bit. And inside the fluid, there's actually nitrogen.
And that's the one that causes the popping sound.
Just for a second, that nitrogen comes out of liquid and becomes gas.
Okay.
For a
I'm
split
relieved.
second. Yeah. So the
Because a lot of
bones
people
are not
think,
popping. Yeah.
Because of the movie that you said, the kind of movie that,
right.
so
the
when you hear that popping sound, it can kill you, it can paralyze you. So it's not that.
It's not that.
Oh,
Yeah.
aliya po yung butuling mag-crack nung ita po kanong nitrogen pa, magluwal na ng nitrogen that makes the popping sound.
Yes.
Okay, so are there any risks?
Well, people who are, chiropractic is for anyone at any age, really.
But are there some kind of pain or disorders that are not appropriate to be treated by a chiropractor?
As far as the adjustment is concerned, if you osteoporosis, for example. So if we know
Osteoporosis.
Yes, if the bones have become very
Too
brittle,
brittle, yeah.
we're not going to be doing. We'll be doing work with the soft tissue. So we won't be doing the thrusting and making the bones move that much because the bone in this type of an individual has become more brittle.
Okay.
Like in elderly women, for example, and they test the bone density. So that would be an
So
example.
other than that, you would think that just about any disorder?
Just about.
Really?
Because it really is very little force. And if there's any, as I'm adjusting someone, if I'm adjusting someone and there's a lot of nervousness about, then I'll do other work besides. I can still do work with the soft tissue.
Okay, so when somebody comes here with a pain, you don't just go around asking him to lie down and do the procedure.
No, I will.
So there are other examinations that you do before
Yes.
you actually.
Yeah. We're measuring. We do measurements of the spine. We do measurements of the leg that will tell us about the position of the pelvis. The pelvis is one of the major areas where the bones can be misaligned. So that's very important to assess.
So tell me, which pains? If our televiewers are watching, okay, what kind of pain should they be experiencing for them to say that I need to go to a chiropractor?
Well, just about any kind of pain, really. But particularly the chronic pains. Particularly, we do very well with those. So these
chronic
are the
pain of the lower back,
knees, anywhere. Because the chronic
migraines,
headaches. Yeah. A lot of times, well, there is a classic migraine that has an aura and there's some kind of a chemical element to that, but many times migraines are actually misdiagnosed and they can actually be cervicogenic headaches instead. And those can be, we can get very positive results by adjusting the neck with many headaches. What we don't say is, we don't say that we're curing a problem. What we say is we're helping the body function better, which is, remember again, the nervous system is now more clear. Once the nervous system is clear, the body heals itself. Remember this.
Yes.
Because we're not actually miracle workers. We just take away the obstructions to the body. Yeah.
So that the signals, you know.
When you're a baby, you fall down, 10 minutes later you get up and you're fine.
Correct.
They have this amazing healing capacity. Now as the body gets aging and more of us, as we get older, more blockages to that natural nerve function occur. A person can still heal when they're older. A person who's older, I would need to see them a series of times. We're going to make progress, but the progress will be a little bit slower.
Okay.
But you notice the kids, they heal so quickly, right? Because the body heals itself. That's the whole point. Yeah.
Okay. Whew. I would like to see you do the actual procedure, but we have another segment. And kaya kung tutuking segment tamo, pakisabihan tala, adwa ka rin pasyente ng Dr. Jan. Ila po ba satisfied la yung malalyari karela? Epektibo ya po ba yung chiropractic para karela? Pakibalwantangan po yan. Uling magbalik ya pa po Personalan. Good living need not be expensive.
Good news po para sa lahat ng subscribers ng Cable TV at Cable Internet. Naisabatas na po ang Anti-Cable Television and Cable Internet Tapping Act of 2013. At ayon dito, bawal makikabit ng Cable TV at Cable Internet. Ang parusa sa sino mang lumabag sa batas na ito ay pagkakakulong at pagbabayad ng malaking multa. Bayad ka na nga, kulong ka pa. Kim Atienza po, nagsasabing pagdating sa batas, hindi weather-weather lang.
Huwag maging supported by the PCTA.
Yata, may nakit na akong solusyon. Karang ka na akong sakit-sakit. Uling bali naman po pa siya tutuwata na. Alay mamaray eh. Pagloko ang kaya po sana, uling imamaray man po dakal niya naman panandaman ng sakit-sakit. But it seems like we've seen Dr. Jan doesn't want to call it the cure, but we've seen the answer to these problems through Chiropractic. At ngayon po, kaya ba tayo pamurin po Dr. Jan? And for this segment, we have two more visitors. Then pong two of the patients of Dr. Jan. We have Girly and Annie. Hi, Girly and Annie. Kamusta? How are you?
Fine.
Okay. Just sit there and relax, Dr. Jan, because I'm going to ask some questions from Annie and Girly and Annie. Okay. Girly, Kapampangan ka ne?
Opo.
Nanong sakit-sakit mo o ba't aisip mong munta kay metong kay chiropractor? Usually, pacheting kung panandaman mga niya, munta ka pa mo kay doktor talaga. Minta na nakabakan ka rin doktor before ka minta ka?
Opo, actually, scoliosis ko po. Ati ko pong scoliosis.
Okay.
So, bali, dakal na ako po apuntalan, doktor, papa-therapy na ako po. Pero ako po tinay kasi,
Marirelieve.
tatakot ko po. Baka yung goal ko.
See?
Ito po
The
sinabi
same,
yun,
the same,
for how many
the
years
same
po?
fear
Yeah.
to have your spine touched because it might paralyze you. Yes.
So, pilang years na ako pong ating scoliosis. But then ako pumunta talagang
Talagang,
so, I'm afraid
oh my
talaga.
God, okay.
Opo, but then,
So, piniis-is mo na mo.
Yeah, pilang years na po. But then, natin ko po nga kapag-obra, ni-refer ni Doc Keller. Doubt ko pa rin po kasi...
Mas lalong makatakot.
Opo, and then, tinry ko kaya. So, first time ko po talagang may palawi kaya. As in, tira niya po talaga itang kay ko. So, itang pain, severe pain talagang pinandaman ko first kay.
May wala.
Kay po. Then after na talagang
How many,
napatagal pa.
really? How many sessions na kanya?
First ko pa po kaya.
May first session ka pa?
Opo. So,
Wow, you're a
then
miracle
then
worker,
after
Dr.
po
Jan.
nita, parang kaya na mo po, second week mayan or 1 month, magpa-kaya na ako mo po.
So, nakamumunta regularly kaya?
Actually, alin na po. Basta
Itang first mo, yung talagang...
First talagang,
Wow.
masanting po talaga. Kasi may relief ko po talaga. Itang pain ko kining gulot. Alam mo po, ito itang stress, itang headache.
Of course! And you can't sleep if you have all that pain.
Opo.
Annie, how about you? What kind of pain were you experiencing before?
Before, when I was pregnant, my one hip was in pain. I couldn't walk properly. So-
During your pregnancy?
Yeah,
Uh-huh.
during my pregnancy. So I visited him at the first time that time, and then he actually fixed it.
Even if you were pregnant?
Yeah.
Really? And then...
So after that, I went back to Korea to give a birth. So I had CS.
Okay.
I came back here, and then I really...
The pain is bad?
The pain, I mean, the other pain.
Oh, another
the lower
pain.
back.
Lower back.
Lower
Okay.
back. It's so painful. So I called him to make appointment to come back here.
Okay.
I had around 20 sessions, right?
20,
With
yeah.
20 sessions.
20
For the sessions for lower back.
20 sessions for lower back.
Yes.
Meaning 20 visits.
20 visits.
Okay, and how is the pain now?
Yeah, I'm better. Much better. I don't have actually really pain now.
No more pain. I mean, maybe...
So about really less.
So if the pain before was 10, how many now?
2.
2.
It's really less.
Uh-huh.
So these days, actually, I really, less.
But did you see other... did you go to other doctors first before you went to a chiropractor?
I even didn't think about other doctors.
Really?
Yeah. So I just okay, when I go back to Philippines, I'll just visit Dr. John.
Okay. Is chiropractor... here in the Philippines, I told you, Dr. Jan, that, the chiropractic is what? Very few people know about it.
Yes.
Okay. How about in Korea? Is it something that people know about?
Yes,
or?
we have.
Yes.
We have.
Okay. But still, you had to go to Dr. John.
Yes.
You have Korean chiropractors, right?
In Korea, I haven't tried it yet, but
Okay. Well,
Yeah.
if you've got the best.
yeah,
why
I
go
got the
to-
best one, so I don't need to go. I really don't think about anyone to go.
Okay, so you are fully satisfied.
Yes.
100%. No doubt about
No.
chiropractic.
No.
Very good testimonies, Dr. John. Congratulations. Okay, there you go. One is scoliotic, and she's afraid to have her spinal cord touched, and you did, and she's okay now, and she's relieved. Okay, one is was pregnant, and you did the chiropractic?
Sure.
Okay.
Absolutely. Yeah.
No risk?
No, not done carefully. Yeah, there's a few of the techniques that we would do differently if someone was pregnant. For sure. You modify, so you do things a little differently, but you can still. When you find the bone that's stuck and the fixation, you can still relieve it, regardless if they're pregnant or not, or any age.
Any age?
Yes.
Not only old people like us? You have young people? You have young children?
Well, I just did someone about 3 hours ago.
Oh, come baby. What was wrong with her?
Well, she's stiff, yeah?
What's your name? Alexis, okay. What, did you have pain before, Dr. John? What did Dr. John do to you?
She had some tension and some stiffness, and it was her father was mentioning. Yeah, your father's watching all the time, so she's at school, and there's some tension being with school.
Stiffness. In what? In her leg?
In the back, in the low back, in the mid back as well.
Oh, okay. And how many sessions did she have?
Well, today was the first time.
You feel better now? Wow! So Dr. John is good? Yes! Okay, stay with us, okay? Okay. Now, Dr. John, one intriguing question. You have a very good career in the States. You're doing good with your practice. Why go to a third world country like the Philippines?
Well, it's an opportunity, because a lot of the chiropractors now, we think that really this is something that should be everywhere. It really should. And right now, it is the beginning. We're the birth of chiropractic in the Philippines. They're really, as far as registered and licensed chiropractors, only about 26 or 27 in the whole country.
Wow!
Yeah,
And
right
I read in your website that you belong. You are affiliated with United Nations Chiropractic Center.
That's right.
And that it is not only here in Angeles City that you have a clinic, but
That's right.
you have other clinics in Metro Manila.
That's
like
right. 4 in Makati,
Makati,
Ermita, Quezon City, and Pasig.
and Pasig.
Yeah.
Okay, and you are all professional health.
Yes. Licensed, board certified chiropractors. Also licensed with PTOC, which is the Philippine Associates.
Yes.
We have the certificates.
And
to
from
practice
the OH,
here.
I believe, the Department of Health?
Yes, it's supported by the Department of Health. Yeah.
Okay, so nothing, no scam there.
No.
These are not crack doctors.
No.
These are for real.
That's the whole point. Yeah.
Okay, ita po, dimdam tayo po. And Dr. John, here are 2 of your patients, very satisfied. 3 of your very satisfied patients. Okay, please invite our viewers. Where can they get in touch with you? Where is your clinic? How can they get an appointment to see you? Please.
Well, we are in Angeles City, in Koreatown actually. So it's Friendship Highway. The address is 151 Friendship Highway, but people don't use numbers so much.
Right.
Next door here we have a restaurant. It's Jiangsu. If you've driven up and down Friendship near the Anunis Bridge, you've noticed Jiangsu Restaurant. It's a Korean seafood restaurant.
Phone number.
The phone numbers that you can call are 045-625-6663, and we have the mobile number 016-475-0365.
Okay, website?
MakatiChiro.com.
MakatiChiro.com. Don't
Yeah.
worry, we're going to write that
Okay.
there. We're going to scroll that there. Okay. So, would you like to say, what buri lang kayang ding bisang Palawe?
Ay, opo. Nung ating ko pong panamdaman about kayang butol, o
Madyang
nano po, stress kayo or masakit katawan, tako po kayang chiropractic ng Dr. Keller, I'm sure marilib kayo po.
Annie, would you like to invite our viewers to try chiropractic?
Whenever you have a problem with your back or something in your body, don't hesitate to see him here. Dr. John is waiting for you.
Okay, thank you so much, Girly, Annie, for your time. Dr. John, let me see you do the demonstration.
Okay.
Thank you so much for your time. Kayo po maglipat channel, ling akit tayo po nung nano talaga in chiropractic, pakit na po kay katamong Dr. John, kaya ni mo po kay
Personalan.
o hindi na po in actual demo ng Dr. John as to makanano ya po ba gagawa ng chiropractic. Okay, at kaya ba tayo po makakera ng ni girly Dr. John, a while ago, a girlie said that she's scoliotic. Okay? And what is this that you're doing to relieve, you know, I know of some other people who have scoliosis and they really tell me that they are suffering from severe back pains. So what is this that you're doing?
Well, now I'm working with the muscles. She tends to have a muscle spasm behind, in this case, the right shoulder blade.
The muscles?
The muscle itself is really in spasm. So I'm working, I'm doing a deep tissue massage into there, and behind the shoulder blade, and I'll also do the other side and farther up on top of that. So in the beginning, mostly working with the muscles.
Muscles first.
Yes, that's the way. Now,
although of course when you say scoliosis, it's her spine. That's,
she has a small scoliosis. It's really not severe. I actually have I have other clients that are up to 50 degrees.
Whoa.
Yeah. So, and in her case, I would venture to say it's borderline, if scoliosis. Yeah.
So you're doing deep massage,
yes.
deep muscle massage.
Yeah, and I'm actually going to come to the other side and work on this. Okay. We're going to
switch place.
Yeah, switch place. So working with the muscles first. If I feel through here, I feel a tight spot, then I can go and I'll find exactly where it is.
That's what a massage therapist does.
That's true. It's very similar, but I'm working more on a deep level. I work in between the fascial layers. So we call it myofascial release. So you know, there's you can work on the muscle, but you can also work where the muscle meets another muscle. So a muscle will have a membrane. It'll be surrounded by something. Now muscles are crossing the body at different angles, and they'll cross on top of each other.
Yes.
And where one muscle meets another muscle, there will be the border between the muscles, and that's one place where you can have
the pain.
An adhesion actually. So they can stick together. It's almost like glue. So by working those through, you can get some of that. You can relieve the adhesion. Once again, that's kind of like glue. So by moving, and also I'm working very close to the bone. So the place where the muscle starts and where it ends is called the origin and the insertion. So every muscle is a simple machine. When it contracts, it brings 2 points of the bone together. So the body is very complicated. It has many different muscles, and they're crossing at different points. So when you have the muscle turns on, it brings 2 points together. Now it turns out that those areas right where that muscle reaches the bone, that's where a lot of problems can develop. So this is where we get a lot of issues. We can get a lot of relief by addressing those areas. Okay, so if you go on YouTube, you can find all kinds of little pictures. They're always fun. Yeah. She's done it enough times. She's no longer nervous of it. So now I can feel in the neck. I'm feeling which of the bones is stuck. You can feel it on the lower neck. There's something right there. That's the one that's not moving. So we hold the neck. We hold it into the position. Find that one. I can make easy contact right on that particular bone. So I can feel the one that's not moving. And there it goes.
God. I heard it. I heard the crack. I heard the pop. Okay.
And on the other side is, there's one a little bit higher on the other side. So it's a little bit higher. But once again, you can find that particular bone where it's at.
Woo. Oh my God. Masakit? So they don't feel pain when you do that?
No, they feel relief.
Relief? Not even discomfort?
Well, maybe the very first time it's surprising. So the fact that it's surprising,
you know,
and maybe there's a little nervousness, so it's the anticipation perhaps.
Yes, because
but after being adjusted,
if you do that in the movies, you're dead.
Right. If you watch those kung fu, you see the last movie, the Chuck Norris or Well, but that's the movies.
Okay.
Yeah, that's the difference.
So that's one adjustment you do around the neck.
Yeah, we're not
adjustments.
Oh, we're not finished yet. We
okay.
we have plenty more. Now, here, let me see. She has an area behind her shoulder blade on the right. Like we were working the muscle before.
Yeah.
But that's because there's something around the shoulder blade that tends to get stuck on her. So we find the shoulder blade right in there. It's the ribs, actually, behind the shoulder blade. So we can actually adjust the ribs as well. So
the ribs? You adjust the ribs?
Sure. Why not? So there's the spot. Feel it in there. Good. There's one. And there's two, yeah? Okay, now
You have to be strong
let's
to
do
do
the other
this,
side.
Dr. John.
Um,
Not really?
you might be surprised. You might be surprised. A lot of it is the setup. So if you get the angle, and you learn, you've done the procedure many times, then it moves rather easily. So it doesn't. That's the idea. If you set up well, then it should not require a lot of force to move the bones. Now we're going to do down the spine. Oh, we got a bunch there, even the hand.
Kumusta ka? Okay mo? Oh my God.
Okay, now we can continue. We can actually do the lower spine. We could do the pelvis.
So that was for the upper back.
Yeah, I prefer to start at the top and move all the way down. That's the way not everyone does it that way. Some people would change the procedure and they go differently. Okay, so turn on your side this way. Good. Good. Okay. Now I've worked on her a few times, so I know where this is a spot. The more familiar you get, then the better you are at adjusting the spine. There we go. And we turn to the other side. And bring the bottom hip a little closer here. The bottom hip, bring the bottom. There you go. Okay. So this is what we call side posture. You can see if somebody lies on their side, so it's side posture.
Side posture.
This is what we call side posture, and very classic. You know, everyone does a version of side posture, I'll tell you. So now we're going for the very bottom here. Good. Maybe it's not going to move today. Nah, it's okay. That doesn't always move.
Doesn't always pop.
And you are all done, yeah?
Babyemi po inke kaming kapasalamatan kareng kakaluguran ng personalan. Teresita Razon's Halo-Halo and Pansit Palabok, Rhapsody in Blooms, located at M&G Building, Dolores City of San Fernando. Thank you, Miss Mila Gonzalez. Ederm, Revolutionary Skin Health, Aesthetics and Wellness. Dakal salamat Dr. Eder and Anal Dizon. Crystal Homes Alasas, building homes, fulfilling dreams at Barangay Alasas, City of San Fernando. Sanctuario de San Fernando Memorial Gardens, Heaven on Earth at Barangay San Agustin, City of San Fernando. Special thanks to our high-tech dentist, Dr. Jose Lizander Galang of JL Galang Dental Group at the Pampanga ENT and General Hospital, City of San Fernando.
palagay ko, kalupa ko, medyo mimisip kayo muna man po nung naniya talaga, nung talagang para kay kayo yaba, ining chiropractic. What is reassuring, kaya pong gawa tamo ngayon, makasigurado tampo, na yung taong gagawa, ken procedure ni, eya mo pumenigaral nung karin, at eya mo pumenigaral nung pilambulan nun apulong banwang pamanigaral, inggewa na pong Dr. John Keller, bangkanta po, agawa na ining kayang practice. Ating makatabang puso po, karakal abansang pwede dang puntalan. Pero mintala po keti, ken kikatamong bansa, at particularly keni po, ken kikatamong lalawigan, bangkanta sumuyula ke kayo. Sana po, kalupa ko, maging interesado kayo naman, subukan tayo po. Wala naman po sigurong mawala kay katamo, pero ating pong siguradong mawala, ing kay katamo pong sakit-sakit keng katawan. Dakal po salamat, at para po keng episode ay ni Buri, kaya pong i-announce kay kayo, nung atatandanan niya po, itang kay katamong pastry chef, ay Chef Melisa Balaga po, aba, mamuklat ne pong kayang kayang outlet ing Matis Bake Shop, kenya po keng Jumbo Genra, mag-umpisa po keng September 15, saliyo na po inganggang buri yung manyaman na cupcakes, manyaman na pastries and breads, ken mo po keng Matis Bake Shop. Okay. Dakal po salamat, Mama Ray. Mismo na naman yung meto nga masanting nga episode. Pero, bali, bayanan da na kuman, den kakatamong talapanalbe, niya po, hangga po keng tutuki, bali naman po, no ka rin na kayo mandala ng kaya kayong paninap, nano man yung kasakitan na danasan nyo o tagumpe nga kamtan nyo, magbalik at magbalik kayo ken pipumpunan nyo, uling at yuko po Kenny, imbis Mau Aquino, maninaya kaya kayo, kambe na po ka na kung kapatad, at kaya kayong kayantabe, imamaray yumang, Kenny mo po keng Personalan. Bye!